Hello, and welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for October 16th, 2024. Thank you for joining us today, and thank you to the current Osteoarthritis Action Alliance sponsors shown here who help support our work, which includes the monthly Lunch and Learn series. Our presenter today is Tiffany E. Shubert. Dr. Shubert has a Ph.D. in movement science from UNC Chapel Hill and is a licensed physical therapist. Her area of research is healthy aging and fall prevention, and she has authored over 40 peer-reviewed articles. She was the lead researcher for the implementation and evaluation of the Otago exercise program in the United States from 2011 to 2018. Her work has expanded to include evaluating the efficacy of the OEP offered in different settings, with different delivery systems for different populations and by different providers. She currently works with organizations to facilitate implementation of OEP and consults with digital health startups to develop solutions for older adults to achieve their personal health span. The title of her presentation today is Empowering Adults with Osteoarthritis to Manage Their Fall Risk. Welcome, Dr. Shubert.
Great. Thank you so much, Serena, and thanks to everyone who is joining today and taking some time to listen and learn. So the way the talk is going to go today, I have this interesting title about empowering older adults with osteoarthritis to manage their fall risk. So we're going to talk a lot about things that if you are someone who has arthritis, you can do to really understand your own risk of falling and how you can manage it. But also for folks who are listening who are healthcare providers and also who are researchers, things that we can all be thinking about and tools that we can be providing to patients to really help them manage their day-to-day abilities. So I'm going to do a brief overview of the problem of falls, and then talk about some of the different interventions that are available, and then do a deeper dive into the Otago exercise program. So without further ado, I do have to do one public service announcement. So you may notice that we're in October, but I just wanted to call out that every year in the month of September, we actually have what's called National Fall Prevention Awareness Week. And it used to be Falls Prevention Awareness Day. It was the first day of fall, very clever. It has expanded, and I'm bringing this to your attention because there's an incredible amount of resources available to educate yourself about your own risk and to help educate others. So just calling that out there, mark your calendars for next year. But these resources are available now. There's a fantastic video by the National Council on Aging of 6 simple steps you can do to prevent a fall. And there's my favorite tool, which is the Falls Free Checkup, which I'm going to do a little deeper dive into later. But this is an online tool that is available to anyone. It's evidence-based, and it is a series of 12 questions that you answer. And when you're finished answering, you get your results. And there's a nice little education piece to it. And then there's also a letter that you can take to your healthcare provider outlining your risk factors and what could be done about it. So now we're going to jump into falls. So the problem of adult falls, and we typically associate falls with older adults, those 65 and older. And one of the reasons why we have so much information about that particular demographic is that's when Medicare starts. So we have a much better ability to track what is happening with that particular group of individuals. So we have a lot of information, and it sounds really scary. We'll talk about it. But we're estimating about 1 in 4 older adults fall each year. And the issue is not so much falling. Falling is never a good thing, but it's not a terrible thing. But the real big problem is the injury that can result from that fall. So 37% of those falls can result in injuries, and that can be anything from a bruise to a concussion to a hip fracture. So it can really have some huge negative impact, and can also result in significant fear of falling, which typically, when that happens, people tend to limit their activity, and then they get weaker, and then they are more likelihood of falling. We have about 3 million emergency room visits per year that are fall related, which is a tremendous number. And falls are the leading cause of injury related death for the 65 and over. And unfortunately, those numbers are getting bigger and bigger, and have really sped up since about 2018. Good news is that most of these falls are preventable. I do want to call out, and I think this is interesting, that there really is more evidence showing that people in the 45 to 64-year-old age group are also falling a significant amount. So 1 in 8 adults in this age group fall each year, 35% result in injuries. So again, we're seeing that really high percentage, almost the same percentage as the 65 and older. And more importantly, and for this particular audience, the risk of falling, if you're in that 45 to 64 demographic, and if you have arthritis, your risk of falling is the exact same if you were 65 and over. And there's lots of reasons for that, but this is a real issue in folks who have arthritis and specifically lower extremity arthritis. So, and this is just really what we see when you go into the literature, is that this is a problem we have got to be addressing in our folks that have this diagnosis, because not only are they falling at the same rate, even at a younger age, they are falling more and they're much more likely to experience a fall. So I just want to call out that people with arthritis are 2.5 times as likely to experience a fall with injury than people without. So as we're working with this population, or if you have this diagnosis, you need to start thinking about this. This is important because we need to take the steps now to do whatever we can do to minimize your risk of falling. So, and then just, oops, sorry. Get to the wrong slide. There we go. And then when you drill down, and this was more general arthritis, but when you drill down to knee OA, again, we're seeing this 2.5 times as likely to fall. So again, a significant issue, one that we need to address, and one that has some really good solutions. So when we think about risk factors, here's what you need to know. Falls are complicated. They're either complicated or they're not complicated, right? Like, some falls, they're going to happen, right? If you're walking up a muddy slope, you might fall, and there's not a huge reason for that, except you were walking up a muddy slope. But other falls are really complex, and they're usually due to multiple risk factors. And this slide shows what's common to many different types of falls. These are highly common risk factors if you did a big study. And across the board, muscle weakness and poor balance and decreased mobility. Okay, so that makes perfect sense, right? Like if you're not super strong and you start to lose your balance, your muscles just may not be strong enough to make sure that you can stay upright. And then there's some other risk factors which may not be as obvious. Vision, absolutely. If you can't see your environment, you may be at a higher risk of tripping over something. Hearing, a lot of people don't know about this one. This is actually a relatively newer risk factor, but we're really seeing loss of hearing is associated with a much higher risk of falls. And again, it has to do with perceiving your environment. It has to do with attentional resources. There's multiple, it's a very complex risk factor. And then cognitive impairment, polypharmacy, arthritis, and diabetes. So these are typical risk factors, like if you look at all these big studies. But what I want to call out is when we start looking specifically with people who have osteoarthritis, the pain and the stiffness associated with that arthritis and managing the arthritis is automatically going to put you at a higher risk level. And it's because it's going to result in decreased mobility, decreased strength. And also a lot of the medications, especially if you're taking opioid-based medications, can really automatically put you at a higher risk because they tend to really impact your nervous system and your reaction time. So just, again, highlighting those risk factors. And what that really ultimately results in is that the individual who has OA is really going to have a much harder time reacting to that loss of balance due to that lower extremity osteoarthritis. So when you think about this, so how do you figure this risk stuff out? And there's lots of tools that are out there. These are not specific for people with OA, but they absolutely apply. So the typical provider screening tools, and these you will see the CDC has a comprehensive screening tool called the Steady, or you may have been asked this if you went to see your doctor recently. But we like to ask, hey, do you feel unsteady when you're standing? Do you have worries about falling, or have you fallen in the past 12 months? So if you answer yes to any of these, that automatically puts you at a higher risk. And then back to that falls free checkup. If you ever want to do a deeper dive, and again, you don't need your provider to ask you these questions. You can go online right now and take this and take this questionnaire. But the thing I love about it is it's much more comprehensive, and it kind of hits all the major buckets: falls history, fear of falling, unsteadiness, leg weakness, incontinence, huge risk factor for falling, one that sometimes people don't think about, more of the high risk medications, neuropathy, and depression. So really great tools available right now. And back to that empowerment piece, you can go online right now, assess your own risk, just like you can take your own blood pressure. You can take it in your home. You can, take it at the pharmacist, and that provides you a data point that you can act on. And by the way, if you ever take this, if you score 4 or more, you are at a higher risk of a fall. So how do we manage risk? Okay, so we know lots of people are falling, and we've got tools to screen. And here's where I kind of separated out. And I think one of the mistakes as a provider that I've made, but also as a researcher, is sometimes over medicalizing falls. And what does that mean? What that means is that there are certain risk factors that absolutely you need a healthcare provider to manage. But that should be a pretty quick one and done type of situation. And then the rest of the time, the individual needs to be managing their risk factors, and they need to be engaged in very specific physical activity and exercise to manage their risk. So again, if you're prioritizing, if you're triaging, on the left hand of this slide is all what I would call your targeted medical management. That's addressing polypharmacy. That would be too many medications or the wrong type. Addressing any vestibular issues you have, any inner ear issues. This can be a huge problem. If you start having issues with your inner ear and dizziness, big time, we got to get that addressed, and that's a medical issue. Vision, hearing, cognitive impairment, a little more of a long-term type of thing to manage, of course. Orthostatic hypotension, that's low blood pressure, and any neurodegenerative diseases. So those need to be medically managed. But then my job as a PT is to really give you the exercises that you need to address your muscle weakness, your poor balance, help you manage your pain, and also really educate you to do the best that you can with managing your medications across the board. And that is something that the individual must do every single day for the most effective fall risk management solutions. Falls are not a one and done type thing. Many of our risk factors, even when we manage them, they're always there. One of the risk factors is age. Like can't really stop that one. So really thinking more about falls like chronic disease. And so folks with arthritis are already well prepared because they've been managing their arthritis. So here's the really cool stuff. There's loads of evidence, an overwhelming amount of evidence that really shows if you do about 3 hours a week of what we call high intensity balance training, you can actually realize a 39% reduction in falls for community dwelling older adults. This is actually a huge number. I mean, if you think about 3 million ED visits, if we could reduce that by 39%, I mean, you're making a huge impact. And when we say high intensity, this is not like high velocity plyo. I mean, nothing that we're not asking people to jump around. We're asking people to challenge their balance, which means that it has to be in standing. I got a little irritated when people are like, yeah, I do balance exercises in a chair. And I'm like, well, we typically don't fall out of chairs. We fall from our feet. We need to exercise on our feet. So you're typically in standing, you are challenging your balance. So you're doing things like maybe standing on one foot, or maybe standing with a narrow base of support, and you're not using your upper body to really stabilize. You're using your upper body as little as possible. And then also you're really challenging your strength. We need people to be strong, and we know that strength training really has a huge positive impact on falls prevention and falls risk management. So the good news is, and like this image is a great one because it really shows this is a huge balance challenge, and the people that are standing on the blue discs and blue mat, they're really challenging their balance because they're on an unstable surface. So now they're really moving their upper body while at the same time, their lower body isn't stable. This is like a perfect exercise. And this is something that you progress up to, which is why only 3 people are on the mat and the other 4 are not, because they're not ready yet for that level of challenge. So, and now we've got loads of programs that really incorporate all these best practices that are available. So there's the Otago exercise program. And then the rest of the programs on this list are programs that are actually approved both to be an evidence-based and effective program for people managing osteoarthritis, but also for fall prevention. So you're basically getting a double whammy for these, which is exactly what we want. So these are all, they're evidence-based, meaning that they have been tested in a research setting, they have been tested in a community setting, and then they've been implemented community-wide. And if you go through the program, you are guaranteed to get the results that you've signed up for. And they all have different outcomes, but it's a good list of programs. So now I'm going to talk just a little bit more about the Otago exercise program. The reason why it has such a funny name is it was developed at the University of Otago in New Zealand. Serena did a great job with pronunciation because people really get stuck on this particular, it's a funny looking word because it's from New Zealand. So it has been studied extensively for the past 30 years. There's over 145 peer-reviewed publications on this specific exercise program. And there's been over 28 randomized controlled trials and consistently 30% reduction in falls and fall-related injuries. And actually way back in 2010, they actually did a big meta-analysis and showed that there was also a significant reduction in morbidity and mortality. So what's happened really since the mid-1990s, where the program originally was implemented by a physical therapist in the home, is starting around 2010, we started looking at, well, it's a little limited, just having a PT go into the home and deliver exercises. Is this program delivering the same results if we can implement it using different models? Like, could you do a group exercise program? Could you do a virtual program? And really what we found over the last 15 years is that this program is highly effective with different populations, in different settings, with different implementation models. And actually the program was identified by the European Union about 5 years ago as one of the top fall prevention programs of choice. So they are disseminating it all over the country, all over the EU countries right now. And again, seeing really great results. So what is it? It's not rocket science. Basically, you do strength and balance exercises, and the goal is to work up to 30 minutes per session 3 times a week. And then a walking program, again, working up to 30 minutes per session 3 times a week. None of the exercises are ballistic or plyometric, so they're very appropriate for people with arthritis. And also, this particular program is really great for folks who are new to exercising, or maybe coming off an injury, or just, maybe on the lower end of functional ability. It's really the most appropriate for folks who are more on the frail end of the spectrum and who need to be getting stronger. So, and just to give you an overview for folks with arthritis, with osteoarthritis, really what we see, we've got 17 exercises, and the great thing is you don't have to do all 17. So if one is uncomfortable, then you don't do it, or if it's just too difficult, then you don't add it in until you're ready. And there's only one of the exercises is actually done in sitting. So again, we're done all in standing. And again, there's this walking program that the goal is to work up to 30 minutes 3 times a week, and it can be broken up however you want. So if you can walk for 5 minutes pain-free, but then your knees really start bothering you, you can stop. And then maybe you walk for 5 minutes at the end of the day. And maybe you do that throughout your week so that ultimately you're achieving that dose. So there's a lot of flexibility in implementation, and you still get the same results. So again, one of the things I like about this is you can really leverage participant choice. I think it's super important that people are very clear that, you don't just have to do this exercise and go to a gym. hey, where are you going to be the most comfortable? Do you want to do this by yourself in your home? Well, we actually have, some different apps that you can use. There's online videos. Hey, do you really want to be in a group setting? Okay, well, we can do this in a class setting. So again, you can really tailor this program to the needs and the interests of the participant. I think this is really, really important, going back to the empowerment piece. It can be done. The only required equipment is ankle weights. And people get a little like, well, why do we need ankle weights? Well, you need ankle weights because you need that challenge. So even if you're starting out at no weight and you have an empty ankle weight on your ankle, you're now going to have the goal of adding in a half pound. You're now going to add the goal of adding in 1 pound. So it gives you the most bang for your buck. Come on. Yeah. So this is really just to give everybody who's listening an idea of the exercises. Again, these are not rocket science. They're not innovative. The warm up, there's 5 flexibility and mobility exercises for each major area of the body, very gentle. And then you move into the strength exercises. Oops, there we go. Again, these are the knee extensors done in sitting. This is the only one for folks with arthritis that probably is not going to feel great. And then everything else is done in standing, all standard issue, and then the balance exercises. So what you'll see here is that there's a lot of gait exercises or walking exercises. So there's a lot of challenge around sideways walking, backwards walking. The tricky one is usually the heel toe walking, and you do it forwards and backwards. That's when you know that you definitely have conquered and achieved multiple balance skills. And these are all available. Short videos that demonstrate each exercise are available on the UNC Geriatric Education Center website. And that is, there are links in the resource list that you will be receiving at the end of this. So again, implementation models, it really is whatever works best for you. If you are coming off an injury, coming off an illness, if you have significant imbalance impairments, highly recommend that you work with your MD and a physical therapist to start. But if you're somebody who is pretty solid, hasn't had a lot of issues with their balance, then that's definitely an opportunity to do more of a group setting or to eventually transition into a group setting. So, and then I'm just put a couple other things on here that you can work with a rehab assistant, you can work with a rehab professional. There's models where we have the PT as a consultant. There's a great model that's out in Oregon right now where Kelly Murden started this model where she pairs a physical therapist with a senior center, and the PT does that initial screening just to make sure that there's no major issues. And then the center runs a class. So it's really kind of a perfect situation, and it really leverages everybody's abilities and expertise. There are peer-to-peer groups out there as well. There are avatar-led, there's video-led, and we do have some YouTube videos available as well to lead people through exercises. So just in wrapping all of this up here, I really want everyone to hear that people of any age need to be their own fall risk managers. 90% of the reason why people fall is typically not a medical issue, and this challenging your balance and challenging your strength throughout your lifetime is really important to help keep us on our feet. And those are the folks who are doing that are not falling. The ones that are the most effective are the ones that have committed to, and practicing your balance could be as simple as, after you're done brushing your teeth, standing on one leg for 30 seconds, and then eventually, not holding on and standing on one leg for 30 seconds, and then standing on one leg while you're brushing your teeth. It's really hard to do, but you're going to maintain your balance. You're going to maintain your strength. The Otago exercise program is a great opportunity, evidence-based, really appropriate for folks with arthritis. It's slow, it's gentle, but it achieves the appropriate goals and the appropriate dosing. And then definitely check with a healthcare provider if you have any questions or concerns. So at that, I have just enough time for some questions. So I will stop talking and start listening.
Thank you so much, Dr. Schubert. I really appreciate this presentation. I know so many people on this phone call and this webinar have probably picked up some hints and tips and just aha moments. I mean, I just love your message of empowerment. I think a lot of people think of falls risk and they think about losing something, and this program and the ability to do something about perhaps a fear of falls or risk of falls is really awesome. So thank you so much. We do have some time for some questions. So if anyone would like to ask a question, please feel free to pop it into the chat. It looks like we've got one from Melissa Dale, and she says, can the Otago exercise program only be offered by a PT or PTA?
Yeah, Melissa, thank you so much for asking that question. So when we first started implementing that in the Otago program in the US, that was a requirement, but we now have so much data that shows that that actually isn't the secret sauce, that we've really opened it up. So we really recommend that there's a PT available to do some consulting, but it doesn't necessarily need to be delivered by a PT or a PTA. And we have an updated guidance statement at the National Council on Aging that's going to be linked in the resources. So it really goes through what's available and who can implement and how.
Mhm. That's great. Thank you. And there is another question about the costs to implement the program. Can you talk to those a little bit?
Yeah, that is a tricky question. Just because everybody, depending on your implementation model, your costs are going to be different. So at a minimum, you need to buy ankle weights, and you can typically get ankle weights for $10 or less, or you can get really fancy ankle weights for like $25. But then from there, it all depends. Like there's no licensing fee. Like I said, there's YouTube videos available, so there's no cost to access those. But then there's, again, depending on your model. So like if you were going to partner with a physical therapist to offer at a senior center, there would need to be some negotiation there. So I don't really have a set cost. I think the key thing is there's no licensing.
Okay. Yeah. And how about like a leader training or anything? Is there anything like that? Or does a leader just go online? Someone who's interested in offering this, say in a senior center, can they just go online and get the manual and the ankle weights and kind of go ahead and implement it?
Yeah, there is a training at UNC that goes through best practices. And what I recommend now, again, because the program's a little in transition, is, and I believe the cost of the training it's either $35 or $50, but to go through the training and then also go to the National Council on Aging's website and look at the updated guidance statement. And between those two things, you'll have everything you need to implement.
Great. And how about someone who's interested in finding a program? Susan Silver is asking, where or how would you recommend people look for the Otago program in the US?
Yeah, so it is it's very sporadic right now. So start with your senior center and see if they offer it. And then if not, look if to see if there's any physical therapists in your area that offer it. And then the final thing is also look online to see what the options are there.
Great. Okay. And looks like one last question here. Someone who is a PhD student is interested in studying falls risk reduction in public health. How do the Otago exercises determine the exercise intensity? Like what measurement do you use for the intensity?
Yeah, great question. So we use rated perceived exertion.
Okay.
And yeah, and then we'll progress based on that. And if somebody's doing the program independently, we guide them to say, hey, if this has become like easy for you, like around a 3 or 4, then it's time to increase the weights.
Mm-hmm, mm-hmm, mm-hmm. Yeah, that progression is so important. Um, just another just question that I am having is, so if somebody goes through the program, would you recommend that they keep doing the exercises for the long term? Is this something that I assume is not that it's just like a one and done, you do it and then you're forever good at
Yeah.
at
No, it's such a
football.
great,
So
yeah, it's a
what,
great question.
what do you recommend?
Yeah, so there's two things. One, you have to continually challenge yourself. So depending on where you are on your own journey, this may just be your exercise program. And actually in the original studies, they went back 2 years later and people were still doing the exercises and they were still getting a protective effect against a fall.
Awesome.
But I've also had folks who've gone through the program and they've got it. And now it's gotten too easy. And that's when you want to go, okay, maybe it's time to transition over to a more challenging program like a Tai Chi program or enhanced fitness. So you have to,
Mhm.
again, we just always have to keep challenging ourselves. And then the flip side is if you've like taken that next step and now you're in a Tai Chi program and let's just say you get ill and you're, out of pocket for a couple of weeks and all of a sudden you go back to Tai Chi, you're like, oh, this is a little harder than I think it should be. Then you can always go back to Otago. So it's always good to have options.
Absolutely. Great. Well, this has been really wonderful. Thank you so much, Dr. Schubert, and thank you to everyone who attended today's presentation. In just a moment, we're going to launch a brief satisfaction poll, so please make sure to take just a few seconds to answer those questions before you leave. And we will also be following up, as I mentioned earlier, with an email with the link to the recording and some additional tools and resources. So please be on the lookout for that. And finally, we hope you'll join us in November, on November 20th, for our next Lunch and Learn titled, We Understand the Risk of PTOA After ACLR. Do Patients? And this is featuring Laura Schmidt and Elizabeth Wellsant. And so we will put a link to registering for that Lunch and Learn in the chat. So please go ahead and do that as well. So thank you so much, Dr. Schubert. Thank you for this wonderful information. And again, thank you to everyone for participating today.
Thank you so much. Have a great day, everyone.